Health for Life. This is the first ever medical show on television that deals with prevalent health problems and concerns, and they do so in an easy to listen to question and answer format. To find out what we're discussing today and to introduce us to the visiting specialists, here is the producer and the host of Health for Life, Dr. Surendra Prasad.
Good afternoon. I am Dr. Surendra Prasad, and welcome to another episode of Health for Life. Health for Life is a program designed to inform the public about common medical issues. Today, we will be discussing vaccinations. My guest physician today is Dr. Karen Butters. Dr. Butters is a well-known general practitioner who has been in private practice for over 5 years and currently has an extensive pediatric practice. She works primarily out of the St. Joseph's Mercy Hospital. Dr. Butters, thanks for joining us today and welcome to the program.
You're welcome. Good afternoon.
So as we mentioned a few seconds ago, we will be discussing vaccinations. Dr. Butters, what are vaccinations?
Vaccination is actually a process by which we go through and we vaccine children with a preparation of a weakened or a killed organism. It could either be a bacterium or a virus, or a portion of that bacteria virus that is given to the individual, and it stimulates antibodies production against that particular disease.
What is the expected benefit of a child receiving vaccinations?
Firstly, the most important benefit is that it can save your child's life. It's very safe and effective, and it protects others that you care about immunization. It protects also the future generation. For example, smallpox has been eradicated. German measles, we know that if mommy is protected, well then baby would not be passed on to baby. So really, vaccines are safe, and we really encourage mothers to vaccinate their children.
I'd like to go back to the safety issue which you just mentioned, because I'm sure in your practice and parents and you read about, there's always this concern. Are vaccines safe?
They are super safe,
okay,
and they're very effective.
Now, being a parent myself, I remember when my children would get vaccinations, the doctor would always give us a little talk about the side effects. So what are the side effects the parents should be expecting when their children are going to get vaccinations?
Side effects are very mild. You can get an initial fever anywhere from 2 hours, 1 hour, 2 hours, into 3 days after the injection. You may get some pain or soreness to the injection site, and the baby may be a bit fussy for a couple hours, some prolonged for a couple of days, but severe reactions rarely occur.
Okay.
They're very mild.
And what are the general rules? What do you tell your parents about how they should treat these side effects?
Panadol is the safest thing for them to give. You can also put a wet towel, a cool towel over the injection site just to cool it down. But basically those are the means that you would use for treatment.
Okay. As with all things in medicine, there are risks and there are benefits. You've spoken about the benefits. Now, what are the risks of vaccinations? Or I guess, what are the risks of also not being vaccinated?
Well, the non-vaccinated children could get the disease. Okay. And that disease that we're trying to prevent could cause them to be debilitated or even die. They could cause serious harm. And even though they could die, if you become vaccinated, you eradicate all of those effects. Just like any medication, you can have a severe reaction to a vaccine.
Okay. And now let's go back. So what are the benefits that the child will have from vaccination and the population will from vaccination?
Many infectious diseases that once routinely killed or permanently injured mankind, they're now either eradicated or they are at an all-time low.
Now, when you look at the sheet about the number of vaccinations and you see this schedule, I'm sure your parents have asked you, can the baby's immune system get overwhelmed by this long list of vaccinations?
I usually like to tell them that the infants are usually around trillions of bacteria or thousands of viruses are around, their environment. And their immune system actually manage them very well. So the vaccines they receive in the first 2 years of life are nothing in comparison with those many, many, many organisms that they are around.
When you look at the schedule of vaccinations, I'm sure many parents have asked you this question. Doc, why does my child have to get so many doses of this medicine or this vaccination?
They need more than one dose to be fully protected against the disease that the vaccine is intended to kill. So you have to get more than one dose.
Now, when you look at the schedule, another question I'm sure they ask you is, why does the vaccines have to start at such an early age?
There are two reasons. Natural immunity actually decreases from about 2 months. So the baby is not fully protected with their mother's antibodies from about 2 months of age. And actually that is the age when the body's immune system works best. So we target that and we give them the vaccines from 2 months.
Okay. You mentioned natural immunity. I think we need to pause for a second and explain to our listeners, what is this natural immunity that the children are going to have?
Natural immunity is actually immunity that is passed on from mommy to baby. It doesn't need any stimulus or antigen to stimulate it. So it is a natural thing that mommy passes on,
and that's
her antibodies.
Yeah.
Yeah.
And that's what you're mentioning will last for about 2 months.
2 months. It starts to wane from about 2 months.
2 months, yeah. Okay. Now, again, when you look at the vaccine schedule, you see sometimes multiple letters. And I gather those are combination vaccines. So what are combination vaccines?
Combination vaccines are actually vaccines that are put together, the manufacturer. And it's, for example, the MMR, measles, mumps, and rubella, is a combination vaccine. The pentavalent that we give, the diphtheria, tetanus, pertussis, the Haemophilus influenza, and the hepatitis B, all those, that combination is in one vial. And that is what we call a combination vaccine, that you get multiple protection against these different diseases.
I guess one great advantage of that is the child doesn't have to receive multiple sticks.
Exactly.
So the parents should be reassured that it's a good thing because it's less needle sticks for baby.
More.
Okay. Now, another concern is when a child is sick, can they still be vaccinated? Are there special circumstances when you will say it's okay, and other circumstances when you will say it's not okay for the child to be vaccinated?
Yes, a child with a mild illness, flu-like symptoms, or even diarrhea could be vaccinated. There's nothing to say that the child's immune system would be so depleted that they would react to that vaccine. So yes, the mild illnesses, a cold, a cough, diarrhea, yes. If a child is actively vomiting, we would not give it might not be wise to give the polio, those vaccines that are PO, for oral. But a child could be vaccinated when they have some mild illnesses. The severe illnesses, no. If a child has a high-grade fever above 102, 103, no, we do not give their vaccines then.
Now, you just mentioned that there are some vaccines which are given as injections and some which are given orally minimum. Yeah. So which are the ones that generally are given orally?
The polio vaccine, we give 2 drops orally, and the rotavirus is an oral vaccine. Those 2 are the ones now that use orally.
You have mentioned polio, so let's talk about what is polio.
Polio is a crippling and potentially deadly infectious disease, and is caused by a virus. It spreads from person to person, invades the brain, the spinal cord, and the nervous system. So you really don't want your child to get polio.
And that is what is the oral vaccination.
Yeah, oral vaccinated against that.
Now, you are giving the child a vaccine, as you mentioned, and one of the questions is, does giving that child a vaccine makes the child's immune system, weaker?
No, it doesn't. The immune system makes the antibodies against the germ, whether it encounters it naturally or whether it is exposed to it through a vaccine. So the immune system actually boosts itself for that. It's now weaker.
Now, you did mention that when you're getting the vaccine, you're either getting a live vaccine or you're getting one that has been killed. I guess the natural question is, can giving a vaccine to a child cause the disease to occur?
No, many researchers have gone out, studies have gone out. The answer is no. The amount of killed or the live attenuated pathogen injected into the body is far too small to produce the disease, but it is sufficient enough to prevent it.
And that's one of the beauties of our immune system. It's just giving you a little bit to get the immune system cranked up. Now, explain for our viewers, what is the difference between immunization and vaccination? Because I think sometimes the terms get confused.
All right. Immunization is actually the term for making someone immune to a disease. Okay. Vaccination is a form of active immunization. So vaccination is actually the means by which you immunize.
And how does immunization work?
As I said, the bacterium or the virus, the killed or the live, is introduced into the body in its inactivated or in its active form. And this body works by preparing the child's body to fight the illness. The body practices fighting the disease by making antibodies that recognize specific parts of that germ. This permanent or long-standing response means that if someone is ever exposed to the actual disease, the antibodies are already in place, and the body knows how now to combat it, and the person doesn't get sick. So it's actually just this machine-like thing, and it boosts the body. The antigen comes in, say, okay, I'm here already. Okay. I can't get sick.
So when you look at the schedule, again with vaccination schedule, you see that a lot of the vaccinations, the clear-cut recommendations are in early childhood. How long does the immunization last? Is it lifelong, or do people need to get boosters somewhere along the line?
All right. For the children, we need boosters. And boosters are given at different stages of their childhood life. But the vaccine itself, most vaccines actually last for about 10 years. The MMR lasts about 15, effective for about 15 years.
Okay.